Hello, everybody, and thanks for joining this PMP Tab webinar. My name is Melissa McClaus, and I'll be moderating this webinar together with my colleague, Daniel Beltran-Alcrudo. So I'm just going to share my screen here. Let's see, share, presentation mode. Okay. So these are just a few housekeeping slides about the webinar. We recommend these settings for the webinar to exit the full screen. Some of you I see have already used the chat box to introduce yourselves. Please do that. It's nice to know who's joining us. And then in the bottom, you'll see a Q&A button. So if you have any questions, please use that Q&A option to ask questions, and we'll address them at the end of the webinar. So today we have a very nice session about the OutCost tool, which has been developed to estimate the cost of outbreaks. And we have two presenters joining us from the University of Barcelona, Dr. Mafalda Mil-Homens and Dr. Giovanna Ciaravino. Following their presentation, we'll have a live question and answer session. So please do put those questions in the chat box. Just a few notes that the webinar will be recorded, and the recording will be available on the FAO website after the webinar. So you can view it again, you can share it with some of your colleagues or networks who might have missed it. And I've already mentioned about the Q&A box and the chat. So this is actually, I think it's our 25th webinar, part of the Progressive Management Pathway for Biosecurity Community of Practice. And we're always looking for presenters who can tell us about their work related to biosecurity. So if you're interested, please do contact us to present in a future webinar. And we really encourage you also to join the community of practice where you can easily access the webinar recordings. We have a database about case studies related to the biosecurity. We have a discussion forum and more. So you can see this QR code, and I can put it also in the chat about how you can join that community of practice. And so now I'll hand over to Daniel to introduce our speakers and the topic for today.
Thanks, Melissa, for the introduction. It's a real honor to be able to co-moderate this webinar on OutCost. It's a tool that's been very dear to me since we've been working together with the colleagues from Barcelona for many years now, with Vania, with Mafalda, also with Jordi and other colleagues, and many colleagues in countries where we've been validating the tool. So this is a very a large effort that involved a lot of different people, and it's great to see the results coming up, and like the tool becoming used more and more over time, and becoming like one of the FAO corporate tools to provide technical assistance to countries. So with no further ado, I'll introduce our two colleagues presenting here today. Dr. Mafalda Mil-Homens. She earned both a Doctor of Veterinary Medicine and a Master's in Animal Science from the Faculty of Veterinary Medicine in the University of Lisbon in Portugal. She later completed a Master's in Preventive Veterinary Medicine and a PhD in Population Sciences in Animal Health at Iowa State University in the US with a minor in statistics. She's currently working in the Department of Anatomy and Animal Health at the University of Barcelona. And she has started her residency at the European College of Veterinary Public Health, ECVPH. Her research focuses on disease surveillance, biosecurity, and risk modeling in animal populations. And our second presenters, Giovanna Ciaravino. Dr. Giovanna earned her Doctor of Veterinary Medicine from the University of Bologna and her PhD from the University of Barcelona. She is a postdoc researcher at the same department within the Autonomous University of Barcelona. And her expertise lies in epidemiology applied to veterinary and public health with a focus on the prevention and control of zoonosis and infectious diseases of ruminants. And her research interests include disease modeling, risk assessment, surveillance, economics, and social sciences applied to animal health. So the floor is yours, colleagues.
Thank you, Daniel.
Thank you. I will share the screen. Can you see the screen?
Yes.
Okay.
Okay. So thank you for the kind introduction. Good morning and good afternoon to everybody. In the presentation, today presentation, we are going through a brief introduction of the tool, and then we will see the development in the different species over the years, and we will give a brief example of some results from the case study that we have obtained from the case study. Next, it's working, the remote control, but next, please. In the frame of biosecurity, we can say biosecurity is of a key component in all prevention control programs. It can be very useful in achieving and maintaining health status in area where diseases are already present. It can contribute to the success of eradication and control programs. And its importance became even greater when we talk about the diseases that are not present in a territory, like such as transboundary animal diseases, because biosecurity in this case represents the only barrier in the time lag for the introduction of the disease in the territory and its detection. However, the adoption and especially the maintenance of biosecurity requires a set of attitude and behavior of people toward the prevention of risk. And this can be influenced or can be determined by different factors. Some factors more linked to the individual experience, such the knowledge, risk perception, and other more general as social, political factor, and also economic consideration. Such economic consideration can guide the decision making, not only at farm level, but also at regional level. And the availability of evidence on the economic consequences of disease can ensure the effectiveness of communication toward farmer and the private sector on the importance of prevention, as well as at level of risk management can encourage the authorities to invest in prevention. However, although at national level data are usually present and collected, and they are not always analyzed, so this information is not always easy to get. And when in the few studies that are published, especially on transboundary, on the economic impact of transboundary animal disease and its control, since the methodology are often different and the factor included in the calculation are not always the same, making comparison or having a wider overview, it's almost impossible. So to fill this gap, the FIO, in collaboration with the Autonomous University of Barcelona, developed this Excel-based tool that offer a standardized approach to estimate the direct cost of disease outbreak and the cost of implemented control measure to control the spread of the disease. It also incorporates qualitative evaluation of in other indirect costs that can have an impact in a territory, such as social behavior, environment, human health, tourism, animal welfare, or some other aspects. The tool can be used retrospectively to calculate the cost of actual epidemics, but it can also use it to create scenario and test hypothetical management strategy. It is species specific. We have a different version, one for poultry, swine, and another for swine, and then for ruminants. All the versions are accompanied by manual that can guide the user to the data introduction and the interpretation of results. And for the version developed for pig disease and poultry disease, they are both available at this in this webpage, at this address that you can find in the presentation. So a few words on the history of the story, as Daniel already mentioned. It's several years that we have been working together on this idea that rise at first after the epidemic of lambskin disease in the Balkans in 2016-2017. With this publication is where the idea of having a tool started in our mind. And then in between 2019 and 2021, we developed the version for pig disease that was the formal announcement of the tool. This later on in 2022 was adapted at ruminant disease with the collaboration of the European of the EU FMD. With their call for fund applied to the research. And then recently in 2024, we published the version of the tool adapted to poultry disease that also, as I mentioned, is available online. At the present, we are working on the development on a module that can be applied to estimate the economic cost of the control in endemic setting. Regardless the species or regardless the species, the tool that is in Excel is structured in different spreadsheets. One is dedicated to the introduction of data, called input. Then 3 spreadsheets are dedicated to the visualization of results. And the last, focuses on the qualitative assessment that I mentioned above. All computation are based on a deterministic model. So to have variation, if you think that some variation in the estimate is needed, you can work with the worst best scenario option, modifying specific input data. To run the model, we need to collect a certain amount of data. This data focus on census and production parameters, data on the affected farm and the controls measure applied in affected farm, control measure applied at risk farm, namely neighboring farm or farm with an epidemiological link to confirmed positive farm, measure applied to general population and other centralized activity. If we think of the tool, it looks like this. There are 5 blocks color-coded, and each block corresponds to a section that I've just mentioned here. As you can see, the correspondency in the numbers. Regarding the output, we have 2 spreadsheets, overall cost and aggregate cost, dedicated that show a summary of results and aggregated results. And then we have this breakdown cost that it's a huge table with more than 100 items, where the detailed cost for each activity and each items within the activity is represented and described. The results are also aggregated in thematic blocks, the direct impact of disease, including treatment, diagnostics, and other measures in affected farm, and so on, following the same logical structure of the introduction of data. So when we look at the Excel tool, in the overall cost, we can see this kind of results. We have a table with the 7 main blocks summarized either in the selected currency that you can select up to 2 different currency to show the results, and also some proportion and related figure are provided. In the same spreadsheet, you can find a very, even though aggregated, a more detailed description of the cost of what it's included, what activity are included in the different sections, either immobilization or stamping out and so on. In the aggregate cost, you have more information on the mean cost of activity carried out in the outbreak, in connected farm, and also we have information on what sector assumed which proportion of the cost, but also which sector covered the cost of specific activity. You can have these details. And also a summary table of the cost by production type is provided. You can see here an example of table in the bottom right of the screen. And this, don't get scared, this breakdown cost that is for people that are really interested on all the details of the calculation, or if you want to extract data for other type of estimation, you can have all the details. Here you can see the either with a general block, either if it's an outbreak or at-risk farm, then this is subdivided in macro activity within the block, and then each macro activity is again subdivided in specific items that are this individual row in the table. In the same table, you have the overall total for the country, the results divided by sector, veterinary services and farmer comes by default, and then you have a third that can be, the user can specify. And then also here, the detailed results by production type. So moving to the qualitative assessment, the last spreadsheet of the tool, it focuses on all these aspects are highlighted here in the figure on the right in yellow that are not included in the quantitative assessment that I have just described. So for this category, for these main themes, we also have a series of items that can be evaluated through a qualitative assessment that is based on a bidimensional risk matrix. The user have to indicate, have to score the likelihood of occurrence of certain aspect, of certain impact, and then also the severity of the consequence. And according to this risk matrix, the model will return the level of concern. In the last version of the tool, we also added the uncertainty. The uncertainty, it's a rough, very approximate estimation of how much the user is sure of the value that is being using, or of the score that is being attributing to this to individual items. This can be due to natural variability or to lack of data. We cannot discriminate this. But in a certain way, the tool is able to give you a visual results that took into account either the level of concern and the uncertainty. You can see as example the figure on the right, where we have in the highest part on the top items and blocks with higher concern, and on the right part blocks and items with low uncertainty. So at the end, all items that follow in the top right quadrant of the figure need a special attention because can have a strong impact, and it's almost sure that this will have a heavy impact on the country if this is introduced. To date, we have used this tool with more than 20 countries and more than 20 also case studies. 17 were real estimation, retrospective estimation of real outbreaks, and 6 case study focused on scenario. And the tool have been validated with 7 different diseases across the 3 species. In all case study, all the data have been, the case study were conducted in strict collaboration with national consultant that provided all the data and all the information and had also the knowledge on how activity have been carried out in the field. So, what are the possible application of this tool? What kind of question the tool can help to answer? So here in this slide you can see some example, and then now with some case study I will show you which kind of answer we can obtain to this. Okay, so at the end, the usefulness of this tool is either to strengthen preparedness of risk of country, health authority and risk manager, informing the resource allocation for future outbreak, or if outbreaks move to new area of the same country, increase being more prepared and having more informed mitigation plan and resource allocated. It can also be used for advocacy to raise awareness on the importance of prevention and stimulate and encourage the national, international mobilization of financial resources. It can also be used to stimulate the collaboration between private sector and public sector, and for transparency reason. Finally, it can be also a tool that or that ensure effective communication on biosecurity, on the importance of preventing this outbreak, and highlighting the value loss due to the occurrence of disease outbreak. So now I'm moving to some example of the case study. The version for ruminant was used in Central Asia and also in the Mediterranean country for different disease affecting cattle and small ruminants, such as lambskin disease, smallpox and goatpox, foot and mouth disease, and also petit ruminant. To show you some example. One moment, to use some example. In Greece in 2014, sheep, goat, and goatpox made more than 250 outbreaks in this epidemic in 2013-2014, and the 83% of the total cost was dedicated to the outbreak management. In 2017, we had only 36 outbreaks in the Lesbos island. And also in this case, the vast majority of financial resources was spent to respond to these outbreaks. And the same situation then we have observed in Spain recently, where we had 30 cases in the south of the country. Different is the situation, was the situation for PPR, for example, in Bulgaria, where in 2018, the activity, that most costly activity was in investigation and immobilization in at-risk farms, while in this very recent outbreak in 2024, where stamping out in this case was not applied, and either vaccination was not applied, only there was surveillance, active surveillance and immobilization, restriction of movement. So in this case, as you can see, the main cost drivers were allocated to the measure in the general population. To give another example of who pays for all these outbreaks, we have a very different situation, even though in the most of cases, the support of the veterinary services, the cost that involve the veterinary services is the higher part. We have can check as example 2 different context. For example, in Spain, where the costs were more or less equally divided between farmers and the veterinarians, or for example, this that I just mentioned case from Bulgaria, where 88% of the cost was assumed by the farmers. We can check what was the most costly activity in these 2 contests, and in this case, the different proportion that were involved in the 2 countries. But we can also look inside of this section, for example, in the management of outbreak, that in Spain, afford almost the 76%. We can check and see that more than half of the cost was due to the compensation for sacrificed animals, although also farmers, I'm working with it. Thank you. Although also farmers had to assume 16% of the cost. If we have a quick look to the other example, in the PPR in Bulgaria, where I mentioned there was no stamping out applied, there was only 1 outbreak, but for this outbreak, the 97% of all the money that the country invested in the control of this country were due to the mobilization of farm, and in fact assumed by the private sector, because there was no compensation for this. Within this immobilization, we can have a detail of how much it costed maintaining animals when this cannot be sent to the slaughterhouse, how much costed the sacrifice of animals for welfare reason because lack of feed or space in a farms, and how much farmer lost in market or due to price reduction. And this is an example of cost that we can use also to talk with the private sector. And then I give the floor to Mafalda. Thank you.
Can you hear me well? Yeah?
Yes.
Okay. Great presentation, Vanya.
Thank you.
So now I'm going to continue the presentation by giving some examples, such as Vanya just did. And I'm sorry for my voice, I'm sick. So I will continue with the OutCost pig. Okay, so for the OutCost pig, we work with 3 different diseases: African swine fever, classical swine fever, and foot and mouth disease. And we worked with countries from all over the world, from Asia, South America, Central America, and Europe. And for this specific presentation, I'm going to talk about the African swine fever cases in the Balkans. More specifically in these countries here: Albania, Bulgaria, Kosovo, Montenegro, North Macedonia, Romania, and Serbia. And as you can see, the number of outbreaks per country differed widely, with, for example, Romania having 340 outbreaks and Albania only 1 outbreak. You can also look at the size of the pig population. It varies a lot. And we will see that these things will impact how countries will implement their measures. So specifically for these countries, you can see a lot of differences in the main response they had. For example, Albania had the resources allocated to measures that were applied in the general population and also in the border control and coordination. And that was very different to what happened in Bulgaria and Romania, for example, where you can see that almost all resources were allocated in the outbreak response, so the response to the outbreak in the affected farms. Then in the other countries, you can see that it also varied. So for example, in Kosovo, you had most resources allocated to measures in connected farms, to the ones that, so farms that were at risk. Then in North Macedonia, you can see that the majority of cost was to the wildlife, so wildlife measures. And finally, in Serbia, it was mostly related with surveillance. And if we look at who paid what, you can see a lot of difference here also. So if you look at farmers, you can see that in Bulgaria, Albania, and Kosovo, farmers were the ones that paid the most. And then if you look at North Macedonia and Serbia, you can see that almost everything was paid by the veterinary services. And by looking at now Bulgaria and North Macedonia, we will break down these costs. And as I mentioned before, for North Macedonia, you had the majority of costs in wildlife and also a little bit in farms that were at risk and in surveillance. Then in Bulgaria, you had almost everything related with the control of the outbreak in affected farms. And if we break this down, we can see that for North Macedonia, for example, the cost was all for surveillance in wildlife. And in Bulgaria, it was all for stamping out, more specifically for compensation to farmers that used stamping out, and also the cost that was paid by farmers due to stamping out. So this is just some of the things that we can discover by using this tool. And now that we went through the swine, I'm going to the poultry. And for the poultry cases, we looked at highly pathogenic avian influenza with, again, countries from all over the world. And you can also see a big range here for the number of outbreaks in each country. We have, for example, Bulgaria with 18 outbreaks and Chile with 187 outbreaks. So a big range here, and also a big difference in the poultry population with, for example, Guinea having 1.9 million and in Ghana having 77 million. When you look at costs, you can see that almost all of them had the majority of resources allocated to the farms that were affected by the outbreak. That you can see a big difference here. For example, in Bulgaria and Spain, they allocated almost all the resources to that. And if you look at Ghana, for example, it also had a big amount of money applied or measures applied in the general population. And for Chile, this country also implemented a lot of measures concerning coordination. Sorry. When you look at the cost distribution, you can see that for farmers, for example, farmers paid the most in Bolivia, in Ghana, and also in Guinea. But then for veterinary services, you can see that in Spain, for example, the veterinary services paid for almost everything, and the same for Bulgaria. And then if you look at Chile, it was almost 50-50. So let's look at Bolivia and Chile. And for these two, you can see that again, the majority of costs were for the farms that were affected by the outbreak. And if you break this down, you can see that, for example, in Bolivia, the cost was divided into three sections. So stamping out for sentinels and carcass disposal, to disease costs, so dead animals, and also animals that were sacrificed. And then for Chile, it was divided in two sections, the disease cost and animals that were sacrificed. So overall, the main conclusion from these studies was that the financial costs varied widely across countries, and that these differences were driven mainly by the different control measures that were implemented in each country. And something that we think that it's useful, like using this tool is useful for, is that it provides insights into different cost structures and also alternative strategies to deal with outbreaks. So now that we went through the epidemic phase, we thought that endemic diseases also deserve a spot in this book. So we are building an OutCost tool just for endemic diseases. And this one tool will have all the species in it. So we will have, in the epidemic, we have 3 different tools. Now we have everything together. And the main objective is to quantify the costs of the related measures implemented in a country or region due to an endemic disease. The structure is pretty similar to the one for the epidemic diseases. So we have the data introduction part with input, internal data, and then the part with the results, with overall costs, breakdown, and aggregated costs. And as Vania already told, the overall cost is just an overall summary of all costs. Then we have a big spreadsheet with all the costs broken down by activity, and aggregated costs by farm or sector. And here are the categories that you can see. We have this part of laboratory, and we add more information on the surveillance part. Sorry. And also we have the vaccination control measures and I'm sorry, other activities. So for the laboratory part, we have this part here for laboratory capacity and preparedness, basically like bulk costs for equipment maintenance and quality assurance of the laboratory. For surveillance, we had this part, we had this divided in different strategies. So you can implement the surveillance in farm, slaughterhouse, wildlife, or other. And the same thing for path surveillance that I will show next. We added also this part for surveillance in animal movements, because that's really important in endemic diseases also. So before moving the animals to markets or to fairs, and then after the animal return to the farm. And here the passive surveillance, again, you can have, you had this new setting where you can decide the strategy you are going to use. And then for controlling wildlife, we added a little bit more information on the control part. We are finalizing our user guide. And the user guide has all the parameters and description of parameters and formulas that are going to be used in the tool. And the next step is the testing phase. And we are currently working with 2 countries, Kazakhstan and Armenia. And in the next couple of weeks, we will start this testing phase focused on brucellosis. The main take-homes from the presentation. Now, I just want to emphasize this part. The OutCost doesn't give you the direct cost of a disease, but it can give you the cost, of control measures or preventive measures that are implemented due to the disease. Overall, this tool can be very helpful in outbreak management. With the results we have, we can allocate resources and implement biosecurity measures to rapidly respond to outbreaks. Estimate veterinary needs in case of disease spread. And we can also focus on awareness raising and advocacy, mainly on mobilizing resources internally or internationally, and also by promoting public trust in local government in collaboration with the private sector. To finalize this presentation, I would like to thank everyone that has been working with us, the UAB, UFMD, FAO, and all the national consultants. And thank you all for listening to me, and Vanya, and sorry for my voice.
Thank you, Mafalda and Giovanna. That was a really great and very, very clear presentation, I think. Daniel, do you want to join me here? And we do have about 10 or so minutes for any questions for the presenters. And I see that there's a number of them in the chat already. So we can start to go through these. But yeah, I found your presentation. I found it really interesting to see the differences between the countries and how they allocate costs and where the costs are going. And just before we dive into the questions, I'm wondering if you can maybe comment on your experience in communicating these results to the policymakers in those countries, and if they have been used to adapt or to fine-tune the outbreak management strategy. And especially of interest, I think, for this community, you know, if these results are effective in advocating for strengthened biosecurity.
Yeah. Thank you for the question. But I will start answering, but then of course Jordi and Daniel that also have been involved in the case study. What we try to there have been an evolution. I mean, at the beginning, and then in the way we present these results. So this is always in agreement with the national consultant, because in any country it's a different situation. There are countries where it's more effective if communication came from for example, veterinary services of the same country. There are other situations where national consultants can ask as external international expert to provide these results. The willingness of risk manager of listening, also it depends on their priority. I mean, I have not evidence that this tool was able to change priority, but yes, to increase awareness in some point where there was already certain concern. Also, the situation, it's, I mean, my feeling was that the situation was different when the study involved the health authority since the beginning, or if just at the end the results were communicated. So let's say the communication, the effectiveness of communication is not only one aspect. So the tool can help, can give you more evidence, more arguments, but of course is not maybe the only that works. And then also as expert, often we follow the case study until the presentation, but there is no follow-up later on. So really, we don't know what happened in the country, actually. So yeah, Daniel, if you want to.
Yes, I can. Thanks, when I will try to. I will complement your answer with some of what happens afterwards sometimes. So first, I mean, to clarify that within the tool, it incorporates also like a report at the end that covers all the information in a summarized way, as well as the whole Excel with all the detailed information. Also, to stress again that one of the important aspects of the tool is that it allows, once you have all the costs entered into it, it allows to very easily and quickly simulate alternative control strategies. So that's one of what we are stressing more and more lately, is like to make sure that the tool can be used for potential policy changes. On how much the tool has been used afterwards to modify things, and here I think there is this. I mean, as Vania said, there is like every country is a different case, but there is a big distinction. In some cases, we used the tool mostly for validation purposes in certain countries, and like it was really more up to them how they wanted to use the tool afterwards. I'm talking mostly about countries that are not really our usual target countries. So in this case, the report is shared with them and they are informed, but then it's kind of up to them. In some other cases, the tool is applied as part of a FAO project in a country that is a recipient country from this project. And in those cases, I mean, we do try to use the results of this tool to advocate for certain policy changes, which unfortunately usually take some time. So it's not always easy to know how eventually it will lead into changes. But at least I believe countries are very actively using it for their own internal awareness within their policymakers, like to fundraise, to prepare for like outbreaks in other regions, and for sure the potential of the tool could be much broader if the country is interested in, like, I mean, to start discussing with the private sector how this could affect them, and like to discuss who could pay for what. So it's kind of on a case by case, and like it's really then up to the countries to see what aspects they want to explore once they understand the functionalities and potential.
Yeah. Sorry, just to add another example that was communicating with the private sector, for example, for the case of sheeppox and goatpox in Spain, one of our targets were really the representative of the private sector, and they were interested in see different scenario with different amplitude of the movement of restriction, because this was what could affect the economically their farmer, let's say, so to be better prepared. And in this case, especially when it comes with movement of live animals, I think this is a good opportunity, maybe not directly to change things, but to start a dialogue on certain aspects, because on the animal movement is also where biosecurity can really help in preventing the spread of disease. So.
Okay, thank you. So, clearly the tool can be taken on in different ways in different countries. And we have a question in the Q&A about whether the tool can be used at farm level or just at national level. So I would assume at farm level that this that it's more intended at a higher level, maybe within a district or an area, but not appropriate for a farm. Is that correct?
Yes, it is correct. Although according to the type of farm, you can show the mean value, like per farm, how much this would impact, but in a scenario that involve all the territory, let's say. The endemic one maybe will be more farm focused, but let's see, maybe.
Okay. And then I guess a bit related to that, our first question that came into the chat was about how the tool is populated. If you need to populate the cost of every element, or some of them estimated based on the number of farms. And to me, that brings a bigger question about what is the biggest challenge you've had or you've seen in terms of actually applying this tool and getting the data necessary. Is it quite easy to get all these data, or is it sometimes complicated?
There is I'm answering to, but maybe if you want, Mafalda, if we want to say something, I'm thinking of your voice also.
Yeah,
Again.
my voice is not the best today to answer questions. But yes, I think that it's not always easy to get the data. Not
Yes,
always easy, no.
especially production parameters.
Yes.
And census data, census source data on the sides of farm sometimes can be challenging, depending. It's easier with the information related to the veterinary services, let's say. Yeah.
Okay, so
can I add
Jordi.
something? Yeah, I'm Jordi Casal.
Thanks.
I'm
Hi.
former professor of the veterinary faculty in Barcelona, and well, we consider that usually we need more or less 8 days to fulfill all the data, days of work to obtain all the data. That is more or less what we think that can that we can have more or less real data about the cases. And on the other hand, of course, it's not necessary to evaluate all the aspects. In some cases, we have evaluated for a given country, but excluding, for example, the surveillance, that we didn't have any data, and then we calculate for the other parts only. Okay, thank you.
Okay, so it can be a bit flexible in how it's applied. And another question we have here is about the results you've presented in absolute numbers, but can you calculate a range? I know you mentioned about uncertainty for some of the more qualitative aspects, but what about the quantitative ones?
The quantitative computation are on a deterministic basis. So by default, you have no interval, but of course you can, and we already tested this aspect in a case study. You can create a minimum and maximum of certain value where you have more uncertainty, but you have to indicate this minimum and maximum, and you have to run different times the models, so you have the results in your expected scenario, worst scenario, best scenario, and so you can have the range of value there.
That makes sense. Yeah, Daniel?
Yeah, maybe just to complement. I think that in any case, like the absolute numbers of the tool, I think I mean, in this presentation, we saw a lot of comparisons between countries and so on, but like the objective of the tool is not so much to compare countries. It's really like a very country-specific assessment for the country to utilize the results and influence their policy, fundraising, and so on. But it's not always easy to compare two countries where the value of life is different and so on. So it is not really so much the objective of the tool. Saying that, we are also currently trying to estimate the cost of the African swine fever in the Balkans. So like in this case, we are like kind of trying to look at maybe also at the overall cost in the region. But nevertheless, it's still going to be always very much country specific, and like we should not really look into, okay, in this country it costed so much, in this other country it costed twice, because not always it's not really the whole purpose of the tool.
Yeah, totally in agreement with Daniel. Is a very important point, but in fact in this presentation we on purpose have not given any absolute number, so you can compare proportion, that this make the results absolute in terms of currency, level of life, and years also, because when you then compare real amount, you have to take into account different aspects. And then, yes, this was like not really to compare, but just to show the diversity of all the different possibilities that the country have implemented to control and deal with their epidemics. And also, since country have done different things, we at this in this way would like to show the how many different information you can have. And so in each country, when you make this specific study, you can have the whole cost for the country for one activity, and then break it down into more and more detailed aspects as you need, according to the use of this information you want to do.
Okay, I see we're at the end of our hour for the webinar, but there's still a number of questions in the chat. Some of them are quite specific, other ones are more general. So if it's okay with the presenters, what we'll do is we'll continue this discussion in the community of practice. If you don't mind to answer some of the questions in that community of practice. Some of the questions are participants really anxious or eager to try out the tool. So Daniel, maybe we can follow up with some countries about how they might be able to get the tool. There's a question about accessing the OutCost ruminant version. I see that the poultry and the pig are available online. I understand the ruminant one can be shared upon request. So we'll follow up with whoever asked about that question. But in the meantime, I'd like to thank very much Mafalda and Giovanna for a really clear and excellent presentation. To Daniel for sharing his experience in working with this and co-moderating with me, and Jordi for joining. And I know you've been involved in the tool for a long time, so it's great to see how it's evolved and continuing to be applied. I think there's also some questions in the chat about the endemic version, which probably, could maybe be a whole webinar in itself, because I think it's probably a different, it's a different application. Yeah. So Daniel, any final words?
No, it's just it was great to see all this interest, and like the tools have been like validated now for most of species. I mean, all species. We're just working now on the endemic part, and like, of course, any interest from countries to apply, we can help to coordinate. Whether if it's in the region I cover, I would deal with it directly, but otherwise we could coordinate with other FAO regional offices. So thanks everyone, and thanks Melissa for leading all the moderation. I think it was a very nice discussion.
Yeah, nice discussion and lots of interest. So great job, guys. Thank you very much. And to the audience, I hope we see you in the next PMP Tab webinar, which should be in about 3 weeks, I think. Okay, thank you, everyone.